Hi, Dr. Taylor here again. What we're going to do today is we're going to cover a question I get quite a bit in my office is why do you use functional blood ranges? So what we're going to do is we're going to cover both sides. We're going to cover the pathologic or normal lab range, and we're going to cover the functional lab range and the differences between the two. And it'll become quite obvious why we use the functional blood range, whereas your medical doctor will use the pathologic range, your hospital will use the pathologic range, and the one that I always love is why doesn't the Mayo Clinic use the functional blood ranges? Well, this will go over that. It'll be pretty clear once we go through it. So when we're looking at the two, we have pathologic range on the right, functional range on the left. So just off the bat, the pathologic range is used to diagnose disease and pathology. So when you're looking at these numbers, you're looking for disease. You're not looking for health. You're not looking to maintain health. You're looking at, is this person in disease? Do they have some underlying pathology? So we're looking at, we're going to use one blood marker as an example throughout this video. So ALT, typically a liver marker. The the pathologic or lab range is typically 7 to 56. So a big range, 7 to 56, where the functional range is 10 to 26. So quite a bit of difference between the two. So the functional range is used to assess the risk for disease before it develops. So if we're looking at ALT as an example, if you're within that 7 to 56 range, they're going to say no disease, you're good. Everything came back as normal, go home, live your life as you usually do. When we look at it functionally, the 10 to 26 range, let's say your blood marker came back at 40, which functionally is out of range, lab-wise within range. We're going to say, look, we're starting to have some issues with the liver. It's starting to become an issue. It might go to disease, it might not, but let's take it, let's nip in the butt before it becomes disease and keep you functioning optimally. The pathologic range, the numbers will vary from lab to lab. Basically with your pathologic or your lab range, numbers will vary based on the lab. So what they do is they take their patient population, and that's where they get their lab ranges from. For instance, here in Ames, I just looked, the lab range, at least at the time, was 0 to 55 for ALT. Like I say, it's different between the labs, but it's based on their patient population. So who usually goes to the doctor and gets labs drawn? Sick people. You know, you could be the healthiest of the sick people and still have a lot of issues going on. Whereas the functional ranges, they can vary as well. Now you have different authorities, people from research that have come up with these functional ranges. They're really close. They don't vary a whole lot. One of those places, the American Academy of Clinical Chemists, which is the numbers that I use here in my office. So if you're concerned with the pathologic range, you're looking at things for diagnosis only. So when you're looking at the pathologic range or lab range, you're trying to diagnose disease. So it's like we talked about before, within that 7 to 56, they're not going to diagnose you with any kind of an issue with your ALT. You're going to say ALT's all good, there's no disease there, go do what you've been doing. When we look at functionally, we're concerned with prevention before the pathological range. So the same thing we're hitting on before as far as the pathologic range from the 10 to the 26. So like say we're at the 26 range here, the high end of the functional range, and the 56 range here, which is the high end of the pathologic range. Within there's some discrepancy. Like I say, if functionally we'd say we're pre-disease, let's get that before it becomes into the disease state. And that only makes sense. Why wait for disease to occur to deal with it if we can prevent it from ever happening? The pathologic range, care is provided only when disease is present. Like I say, this kind of thing we're hitting on because there's big differences between the two. The ALT, 7 to 56. They're not going to give you any kind of a med or any kind of a therapy or whatever they might do for you if you're within this range, if you're looking at it. Now this goes in broader spectrum and it can get more complicated, but looking at it here, they're not going to give you any kind of a prevention or any kind of a medication or whatever you're looking at going the medical route. So like I say, we're still within, let's say your number's at 40. Well, they might say, well, that's getting up the higher range. We might want to do something about that later, but right now, you know, you hear this phrase a lot. Let's just keep an eye on it. Let's just see what happens. Let's keep an eye on it. Whereas, like I say, when we're looking at it functionally, care is provided to prevent the disease from ever occurring. Like I say, why wait for this to become a disease? Why don't we take care of it here? Why don't we do certain nutritional protocols, maybe diet change, a lot of different things that'll keep this from getting into that disease range. Looking at the pathological range, health is basically defined as the absence of disease. Well, you and I both know that just because you don't have an active disease does not mean that you are healthy. So when you're looking at it functionally, we're saying there's lots of different things that play into health. Making sure you have adequate energy, healthy digestion, your physiologic state is working like it's supposed to. So there's a big difference from the two as far as paradigms. So like I say, paradigm pathologic state is your medical doctor, your hospital. Functional range is our paradigm, what we work with. And you see they're both quite different. And you see, if you go to your medical doctor, which paradigm do they practice in? Obviously, it's over here in this one, unless you're going to a functional medicine doctor who's treating you properly. So, case in point, especially with blood tests, you look at lots of different stuff. We had a patient come in, has anemia. So that's, a couple of different blood markers might say, okay, you have anemia. Is that iron? Is it B12? Okay, it's iron. Let's give you some iron. Well, when you look at a blood test, functionally or lab range, you should really look at the broad spectrum because there's lots of different things that can cause lots of different reactions in the body. So case in point, example, we have a patient who's been anemic for over 20 years. Okay, so we do blood work on her, we look at the different markers, and you know what? Yeah, she has anemia for sure. It's on the blood work, she's out of lab range, definitely, classic. But why does she have the anemia? Look at the other markers, see how everything's working together. All we did for this lady is we corrected her gut. She had gut issues. Put in our specific protocol, healed the gut. Guess what? She's no longer anemic. Goes into her medical doctor, he says, wow, by the way, she's not taking iron anymore. He says, hey, you're not anemic anymore, that's great. Seems like the iron's finally working. A couple problems with that is one, she's not taking the iron anymore, and two, you think after 20 years of being on iron it just all of a sudden starts working? No, it doesn't work that way. It hasn't worked for 20 years. It's been a Band-Aid. Fixing the right issues, fixing the actual issues will give you overall true health. And there's lots of different stuff that can go into that, but I won't get too crazy on it. So, like I say, when I get this question a lot in our office, there's lots of different reasons why we use the functional range, because we're all about prevention. We're about healing chronic issues, and you really need to take a deeper look into things to see what's happening, because you could come in here with beautiful lab work, and almost every thyroid patient does, but something's wrong. Something's happening, and that's where the functional ranges come into play, so we can see the finer nuances and really help these people. So I hope that helps. I hope that makes sense a little bit. If you have any other questions, don't hesitate to ask. And I'll be on here next time.